Hello guys, this is Krishna. Welcome to my YouTube channel. The first question is potassium rich in. So in which among these four options, in which fruit has the highest level of potassium level? Options are apple, banana, citrus fruits or grapes. The right fruit is a banana. A banana has the highest rich source of potassium. The next one is atropine sulfate act as a. Options are hypertensive agent, mydriatic drugs, anticonvulsant, or miotic drugs. The right one is a mydriatic. Mydriatics are the drugs which use for the dilate the pupil. The next one is which one of the following is ideal contraceptive for patient with a heart disease? So when the woman is having the heart disease, so which one of the following ideal contraceptive device? I mean, which contraceptive method is best for the woman with the heart disease? Options are Depo-Provera, that is nothing but depot medroxyprogesterone estate, e-pill, IUCD, intrauterine contraceptive device, or oral contraceptive pills. The right option is option C. IUCD are the best for the a woman with heart disease. So the contraceptive devices, there are three generations. So the first generation has the non-medicated contraceptives, and the second generation are the medicated. Third generation is the hormonal. So there are three generation of contraceptives. The next one is best emergency contraceptive is. So in the emergency situation, which is the best contraceptive is? Options are nalipistone, LNG20, Marina, and progesterone. The right one is the nalipistone. So nalipistone is the emergency contraceptive method. That is best. The next one is best hormonal contraceptive. Options are LNG20, levonorgestrel, Marina, and progesterone. The right one, levonorgestrel. Levonorgestrel is the best hormonal contraceptive. The next one is location of use of walk-in cold rooms. So walk-in cold rooms are present in which, okay, among these four options, in where we can see the walk-in cold rooms. Options are government, private, nursing homes, and pharmacy centers. So the right one is only government. Only in the government sector only we can see walk-in cold rooms. The next one is cold boxes of vaccine carriers are type of. So cold boxes are a type of electrical, non-electrical, both A and B, or none of these. The right one is non-electrical. So non-electrical are cold boxes, but the refrigerators and mm, so the refrigerators all the come under the electrical devices. That is for the storage of vaccines in the hospital. The next one is normal fasting blood sugar is. Options are 150 mg per dl, 70 mg per dl, 70 to 100 mg per dl, 70 to 120 mg per dl. The right one is a 70 to 100 mg per dl is a normal fasting blood sugar. That is before food. The next one is drug of choice in myocardial infarction. That is nothing but MI. Options are signoflame, sorbitrate, salbutamol, sodium bicarbonate. The right drug is a sorbitrate. So sorbitrate is the best choice for myocardial infarction. The next one is dialysis is needed in the condition of. Options are renal failure, Wilms tumor, heart failure, and bladder incontinence. The right one is renal failure. So when the person renal is not functioning properly, so that person has go under the dialysis procedure. So dialysis is nothing but removal of waste products in the blood. The next one is inflammation of breast. So what is the meaning of inflammation of breast? Options are gastritis, mastitis, gingivitis, none of these. The right option is mastitis. Mastitis is nothing but inflammation of breast or mammary glands. The next one is osteoporosis is a. Options are reduced fragility of bone, increased fragility of bone, fracture in the femur, or infection to the bone. The right option is increased fragility of bone. So when the bone having highest level of fragility is nothing but lack of calcium and vitamin D. So due to lack of calcium and vitamin D in the blood, it increases the fragility of the bone, and it leads to the repeated fractures. So osteoporosis is nothing but increasing of fragility of the bone. The next one is, it is a type of traction. So in the picture you can see the attraction. So what is the method of this traction? Options are skin traction, skeleton traction, tendon traction, or all of above. So the right one is skeleton traction. So if you observe the picture here, the traction is attached to the lower part of the femur. Okay, so here you can see the attaching to the lower part of the femur bone. So it is attached to the bone, so that's why it is called as a skeletal traction. So the next one is a purpose of traction in the bone fracture. So in the case of bone fracture, the doctors advise and uh, implement the traction for the patient. So what is the use of having traction for the in the case of bone fracture patient? Options are to heal the bone, or to immobilize the limb, or both A and B, or none of these. The right one is to immobilize the bone. So when you apply the traction, we cannot move the limb. So it leads to the reduce the pain, and to reduce the additional damage to the muscles and tendons, the surrounding fracture area. So the doctors advise for the traction in the case of bone fracture. The last one is identify the condition. So in the picture you can see the eye. Okay, so middle in the eye you can see the white structure. Okay, what is this? Options are glaucoma, cataract, conjunctivitis, strabismus. The right condition is cataract. So cataract is nothing but increasing of opacity of the lens. It is a by surgically we can remove the extra white matter which is present inside the eye. This is cataract. So this condition is called as a cataract.